Hey everybody, today I am coming live from my Ford. So this is my Tuesday morning rant, and I am sitting in a rainy, gloomy parking lot in my car because I am afraid for the reactions on people's faces when they hear this. At home, I got kids running around like crazy, and at my office, there's no safety there, and I don't think the people in Pete's Coffee want to hear this right now anyway. So what I'm going to talk about today is what The Bachelor and healthcare have in common. And I'm going to try to bring that full circle. So here's my disclaimer. This is not medical advice. No matter what you hear, I am not giving you anything to do. It is my opinion on things. Definitely talk to me face to face if you want to inquire about any of these opinions, and I'm happy to do that or respond via email. But do not take anything I say in this video and apply it to your life without first consulting with me, because that may be out of context and we both may get in hot water over that one. And with that being said, my opinion on The Bachelor, it's entertainment. It's adult entertainment. Hopefully kids are in bed. I think from a moral and social perspective, it's ridiculous and silly. It's kind of like a game show. And remember that game show where you get to pick between like door number 1 and door number 2, but you don't really know what you got till the end? I think that's how The Bachelor is. But it's hot topic right now. I know lots of people who love that show, and they get wrapped up in the emotion and the hope and what it symbolizes. And I have to admit, I've watched it a few times over the season, little pieces. Once in a while, I'll watch a whole episode with my wife, and it is entertaining. We'll leave it at that. So the way it compares to healthcare, though, is sometimes I feel like people's relationships with their doctors are kind of like a romantic relationship. You know, in the beginning of dating, you can do no wrong. We call it the honeymoon phase. You just don't see the downsides to things. And for instance, you're sick. You get injured. You go to a doctor. They're your buddy, they're your best friend, they're really on your side, they're smiling, they're willing to help you, and what do you usually get from a doctor? Well, if it's a natural doctor, you get a natural pill. If it's this kind of doctor, you get this kind of pill. But typically everybody's got a way they will work with you, with good intentions. And for a lot of people that works. The problem is, when you look in retrospect, I think there's a lot of problems. So, and the whole reason this reminded me of The Bachelor is because you know how they got to keep it a secret, and then the public doesn't know, but they know, and then it all comes out, and those people are actually watching the show while they're waiting to announce to the public who they chose, and that's when it all gets really dicey, because they go, wait, that doesn't make much sense, or that person isn't how I thought they were, or they see things in different contexts. And for instance, the medical realm, a lot of times pharmacology is really dictating how healthcare works in a lot of physicians' offices. There's just no doctor that could keep up with these drugs and how they work and their interactions. It's just like surgeons. The people who sell them medical equipment a lot of times are training the surgeons on how to use it. It's not medical school. And I'm not saying that's bad. It's just, you go through school and you get out and you have to do your continuing education no matter what kind of doctor you are. But the problem with drugs and surgeries are it's a little dicier than messing around with herbs and natural supplements and things like that. And you're basically trusting salespeople who are really, they have a vested interest in selling their products to people, and then those doctors are applying those products to you in your life, whether it be drugs or surgery. And so all I'm saying is we don't see that part. We don't see the schmoozing and the politics and the lobbying and the things like, I believe I read, I'm not 100% positive, but I'm pretty sure I read it like this, that the American Medical Association and the law states that only drugs cure disease, and food absolutely cannot cure a disease. But I mean, wasn't it thousands of years ago, Hippocrates said that, let food be your medicine? And, you know, it's just, things have gotten a little bit out of hand. And so my point to bring this back is when I was looking at that Bachelor thing and all the emotions and all the frustrations, and, you know, at the end of the day, it was just, it was a lot of little pieces of truth, but no real definition of the big picture of truth. Here's a little piece of how this works, here's a little piece of who I am, here's a little piece of this relationship, and then when you get to the end and you watch it and you put it all back in context, you realize, wow, there's big problems here. And so I think a relationship with a doctor and a patient, there needs to be way more than just try this, try that, and make symptoms go away. When you go to the doctor, I think you need to ask a lot more questions. You got to build a relationship. And if you don't get good answers, no matter how good looking the doctor is, or how sociable, or how upstanding in the community, or how many books they've written, if they're not a good fit for you, you may want to consider trying a new physician that will give you the time and answer your questions appropriately. The questions I'm talking about aren't just like, okay, if I take this antibiotic, what's going to happen to me? Because we all know the answer to that is, oh, there's minimal side effects, and it could cause a little digestive upset, or, you know, don't go out in the sun because you might get a rash and things like that. But you really don't hear the full truth of how this is going to work. Long-term antibiotic use, you know, those antibiotics are killing bacteria. They can't kill all the bacteria off. So what do you think happens to the bacteria that survive the battle of antibiotics? Well, they get really strong, and they change their genetics, so to speak, so they are now resistant, or more resistant to that kind of antibiotic. So those bacteria are going to get stronger and stronger and stronger. In about 6 months, they're going to take over and start running the show again. You're going to get sick again. Guess what the typical treatment for bacterial infections are? Antibiotics. Well, now it's not going to work quite as well. And pretty soon we develop antibiotic-resistant bacteria. And, you know, I touched on antibiotics last time. That's why I'm touching on it now, because there's still a lot of sick people out there. And the point being, it's just not the full truth. And most people in my practice break that cycle, and antibiotics are a thing of the past. So they don't have to look back in retrospect and go, gosh, I wish I wouldn't have done that, or now I'm humiliated because I believed this lie for all these years and I'm sick. And so I would just say ask your doctors more questions. Why can't I lose weight despite diet and exercise and fads and programs and this and that and starvation practically? Why can't I digest my food right? Why do I have chronic heartburn? What is the truth about heartburn? You know, an acid reflux pill or some sort of heartburn medicine is just masking the symptoms, and a lot of times the problem's getting worse. Why can't I sleep? If nobody's really talked to you about sleep and how it could be a blood sugar problem, it could be a liver problem, it could be a brain gland problem like the hypothalamus or the pituitary gland, it could be an anxiety or worry problem, it could be a little of everything, but, you know, it's not going to be solved with just one little technique or a pill. And so I guess my point is ask more questions, people. Because if you don't ask the right questions, just like you'll find at the final rose ceremony or whatever, you may pick the wrong one. You may go with the wrong medical advice, the wrong drug, the wrong surgery. And sometimes you get lucky and you just get burned a little bit and a little hurt. Life goes on. But sometimes you get really damaged. And I have numerous people who come in with the horror stories of what can happen when you mix the wrong medications or get the wrong surgeries. I mean, you got to understand, people die. People die and get sick. And things like Tylenol is one of the leading causes of death in all drugs. And you know how many seniors are dying from mixing the wrong drugs? You know, when you think about Michael Jackson and Whitney Houston and these things, these doctors are being persecuted. But, you know, to be honest, I don't know all the facts, obviously, but I have a feeling these doctors are being used as scapegoats, but they're probably just doing what every other physician does in that situation. A consumer comes in, they want help. The gold standard is give them a prescription to try to make their symptoms go away. It's not popular to tell a patient to white knuckle it or get through it or deal with it, or let's talk about your diet and your lifestyle. Let's talk about your emotional stress. Let's talk about electromagnetic stress. Let's talk about toxins, environmental allergies. Let's talk about, you know, adrenal hormones and thyroid hormones and how the liver detoxifies and colon cleansing. I mean, that's not our healthcare system. However, the honeymoon phase is still going, where you guys actually think you're being told the truth, at least the full truth, and that you're getting good sound advice, and most of the time that is not happening. I have a great pediatrician. He's a medical doctor. He's very respectful of my beliefs, and he gives me options and lets me pick. That's how it should work. Many people have really good doctors, but remember, a good doctor cares about you, but not only cares about you, they answer the tough questions. Sometimes they tell you no when you want something, and they're willing to refer you, and they're always supportive, natural first, and then aggressive second. And if that's not your doctor, then you need to maybe chat with me a little bit further about hooking you up with somebody, whether it's a medical doctor or a chiropractor or a naturopath or a massage therapist or some sort of health practitioner who's going to suit your needs. So anyhow, I hope you're having a great day. This is my Tuesday morning rant coming live from my Ford. And stay dry. We need this rain, I hear, but you know, no matter how much we need it, I just don't like it. I like sunshine and warmth, but that's life. So God bless you. If you have any questions, like always, reply to me personally. DrSeanPatterson@gmail.com, DrSeanPatterson@gmail.com. Visit my site, request my free information, do what you got to do, and have a great day. Thanks for listening to my Tuesday morning rant, and that's it. Bye-bye.